So to start with, when we're looking at this, we are going to be talking about anatomical position. Right? Anatomical position then is when we have an individual that is facing forward, feet erect. Okay? The palms are going to be facing outward, and then the thumbs are going to be facing, you can imagine, away from the body. Right? That's really important, and that's going to have a lot of impact in terms of where we are seeing the positioning of the hands and arms when we look at directional terms. Now, in terms of the different regions of the body, the two main breakdowns that we can make are what are called the axial and the appendicular. Right? So the axial is the axis of the body. So this would be the head, the neck, and the trunk. So if you can imagine taking the arms off, including the shoulders, and the hips off, the legs off, including the hips, that would be your axial skeleton. So this region here. Right? The appendicular then is where you have the joints and the attachments. Okay? So you have the attachments of the limbs, you have the upper limb and the lower limb. As we go through and we look at the skeletal system, this will be a very important designation in terms of how the skeleton relates to the axial and appendicular skeleton. Now let's start off with some directional terms. We are going to focus on directional terms that we would use in humans. Okay. So the first are superior and inferior, and most of our directional terms are going to have two sides. Okay. So superior is towards the head, inferior is away from the head, respectively. Okay. So you could say that the head is superior to the abdomen, right? And the navel is inferior to the chin. Okay. So these are usually used in some sort of respective amount where you're comparing. The other thing is anterior and posterior. Anterior is towards the front, and posterior is towards the back. Now we will see there are two other terms for front and back, which is going to be dorsal and ventral, and those are descriptive rather than directional. Right? So when you have something that's directional, it's telling you how to get somewhere, right? Where something that's descriptive is a description of that item. In terms of if we were to look at the plane and imagine a line right through the middle of the body, middle would be medial. So if you're going towards the middle, you're going medially. Towards the outside is lateral. Now, because these are directional terms, you could imagine you could have something that's between medial and lateral, and that would be intermediate. Okay? So we use intermediate for something that's in between. So when you're looking at this, you should be able to compare any two structures using some of those directional terms. One that's a bit more complicated is proximal and distal. Right? Proximal and distal we usually reserve for anatomical descriptions and directions having to do with the limbs. Okay? So having to do with where on the limb something is given as being closer to the origin of the limb or further away from the origin of the limb. So if you imagine the arm, right? The elbow is going to be proximal to the wrist. Proximal meaning it's closer to the origin of that body part, closer to where that body part comes from. That's proximal. Distal is more distant, it's further away. Okay? So in that case, the knee is distal to the thigh. Right? So the knee is further away from the origin of the body part than the thigh. The last of these, then, is superficial and deep. And superficial and deep are extremely important when you're talking about muscles. Now, we will not look at the gross anatomy of muscles in A&P 1. You'll be doing that in A&P 2. But superficial and deep means towards and away from the surface of the body. So if you look at the muscles, you have muscles that layer on top of one another. Okay? We will also use superficial and deep when we're talking about the integument, which is the skin covering. Okay. When we look at the layering. So something that is superficial is more towards the outside, and deep is more towards the inside of the body. So now let's go through, those were directional terms, and you need to kind of get that basis so that you can think of where things are. Now we're going to go through regional terms to use the proper terminology to describe regions of the body. We're going to start in the superior aspect. We're going to start from the top. We're going to work our way down. We're going to do an anterior or a front view first, and then we'll turn it around and do a posterior view. Some of these are going to be familiar, you've heard before, and some will be new. So the area of the forehead, that is the frontal region, and we're going to see that actually has to do with the name of this bone right here that makes your forehead. It's called the frontal bone. The area of the eye socket is called the orbit of the eye, so we call this the orbital region. The nose is the nasal region. The mouth is the oral region. The cheek region is the buccal. I've also heard it pronounced buccal, depending on who's saying it. So if you've ever watched crime dramas, they may do a buccal swab where they go in and take cheek cells. That's the cheek. The region of the chin, that is called the mental. And later on, when we talk about the bone that makes up the chin, you're going to see there's an opening there called the mental foramen, named by that region. These terminology, these are all linked, right? There's reasons. So if you start to understand the reasons why things are called what they are, it makes it a lot easier rather than just rote memorization. The region of the neck is the cervical region. So if you've ever had somebody who's maybe gotten whiplash, they wear a cervical collar. Now looking at the trunk, the point of the shoulder is called the acromial region. This region right here in the middle, what you might think of as your breastbone, that is the sternal region. The entirety of the chest is the thoracic region, and the area specifically of where the breasts would be the mammary region. Below the thoracic, we have this region here that is the abdominal region, and where the navel is would be the umbilical region. As far as this limb goes, this upper region here, this is the arm. Okay. That's called the brachium. This lower region, this is the forearm. Okay. So that's a difference even in the way we would call this whole thingamajiggy the arm, but this is really the arm and this is the forearm. So this is the brachium and antebrachium. Okay. Whenever you see ante, A-N-T-E, okay, even in something like anterior, it means coming before or in front of. So the forearm comes in front of the brachium. The antebrachium comes in front of the brachium. We also have the region of where the elbow folds in. Okay, that's the antecubital. Right, that's that folding in part of the elbow. And then for the hand, where we have the thumb has its own special name, which is the pollex. The fingers are the digits. So if you think about the digits are the fingers, the palm is the palmar region. Okay. The region of the wrist, where we have movement, that is the carpal region. Now, learning these terms now and working through actually becomes easier and makes much more sense when we start learning the names of the bones, because lots of these are named for the bones. Now working into the lower region, anterior view, the region of the hip is the coxal region. The region where you have the external genitalia, that is the pubic region. The area of the groin is where the thigh meets the torso. Okay, that is the inguinal region. The region of the thigh is the femoral region. The region of the forward bending part of the knee, so the front of the knee, okay, that is the patellar region. Then we have for the lower part, the leg, we have the curl, which is going to be the area what you might consider the shin, is the curl. And on the side of the leg is going to be the fibular. And for the lower appendage, we have the foot. The entirety of the foot is the pedal. Right? If you think about pedestrians, or we are bipeds, we are bipedal organisms, it means we have 2 feet. Okay? Might help you to remember, how do you pedal a bicycle? You use your feet. The ankle is the tarsal region. Here, the toes are the digits. Okay? We do not differentiate between fingers and toes in terms of the anatomical descriptions. In fact, English is one of the few languages where we have a different word for finger and toe. In many other languages, Spanish, for example, they're all called dedos. Right? fingers, so you would say dedos de mano, fingers of the hand, or dedos de pie, fingers of the foot. So just keep that in mind. Our great toe, or big toe, does have a special name. That is the hallux, right? So we have the pollex is the thumb, and the hallux is the big toe or great toe. So that gives you the anterior terminology. If we move to the posterior view, I'm going to turn my little display around. The entirety of the head is the cephalic region. The area of the ear is the otic region, and you may have heard that if you've ever gotten an ear infection and you need to get otic antibiotics or otic drops. They're for the ear. This region, that's specifically the rounded back part where your skull meets your neck, that's the occipital region. If we are looking at the back region, the posterior aspect, we could start again with the acromial, which is the point of the shoulder. Okay. The back then of the shoulder, where you have your shoulder blade, that is the scapular region. All along where you can feel your spine, okay, that is the vertebral region, and we will talk about how the bones make that up. Once again, the back of the arm is still brachial. The back of the forearm is still antebrachial. But now we have the point of the elbow, okay, the pointy part of your elbow. That's called the olecranon, right? So the front is the antecubital, the back is the olecranon. So they actually have different names, and it has to do with the fact that we have a very complex joint here, which we will look at in Chapter 8. Okay. This region where your back curves in, that is the lumbar region. And then the sacral would be this region of your back that is just above and between your buttocks. The region of the buttocks is the gluteal. It comes from the name. Okay. The perineal region, that is a region between the anus and the external genitalia. The back of the thigh is still called femoral. The back of the knee, the front was the patellar, the back is the popliteal. Okay. The back of the calf, or the lower leg, is called the sural. And then on the foot, we have the ankles are still called the tarsals, but the heel, where you put your weight down on your heel, that is the calcaneal. And the entirety of the sole of your foot is the plantar, right? So if you're told to plant your feet, you're really putting down that plantar surface. Like we have palmar in the hand, plantar in the feet. So those are some of the terms, and some of these, as I said, will be familiar. Other ones you're just going to have to go through. This is not something you need to just rotely memorize. As we go through and we talk about more of anatomy and more of how the body is organized, these terms start to make sense, right? They start to come together. Now, one important thing we have to discuss in terms of looking at the body has to do with what are called sectionings or planes. So there are going to be a few different planes we will talk about. You can imagine we could take the human body, we can cut it into right and left halves, right? So we could take a giant saw and cut right through this way. That would be considered a sagittal section. Okay? It gives you a right and a left half of the body. Right? Now there is specifically something called mid-sagittal, which would be right in the middle, but you could make sagittal sections anywhere kind of along that plane. If you're getting a left and a right half, then you have a sagittal section. Now, a frontal or a coronal section would be if we were to cut the body and create an anterior and a posterior, so a front and a back half. That would be a frontal or a coronal suture, section. You will see that when we talk about the sutures in Chapter 7, when we look at the skull, they're going to use these same terms. The other way that you could imagine doing a cross-section would be to divide the body into superior and inferior halves. So you can imagine I could take a saw and cut through right here, right, and remove this top right here. I've just created a transverse or a horizontal section. Okay, so put that right back. These go with the planes, right? We live in a three-dimensional world, so we have 3 planes. You can think of everything. There are also oblique cuts, and what an oblique cut is, an oblique cut would be a section that's made diagonally, so it combines any 2 planes. So you can visualize this if we take this diagram of a human. Right. Here we have the frontal plane. Okay, so if we made a section through there, we'd have anterior and posterior. The median or mid-sagittal plane would give us left and right halves. Transverse plane section would give us superior and inferior. Right? And then what's not shown is oblique. So if you could imagine going on a diagonal, combining any of those, you'd have an oblique section. This would definitely have some important differences in terms of if you were to section through something, what way are you looking at it? That will become important, especially in Chapter 4, when we look at tissues. Now, when we go through and do this, I always get students giving me stories of, oh, I know a person who had 6 toes, and I know a person who didn't have an appendix, and I knew a person who had extra set of teeth. Right? There is always some degree of variability in anatomy in humans. We are going to talk about what is generally acceptable, right, and what is generally the quote-unquote normal. But there's always some degree of difference between different humans. There are some really extreme anatomical variations, but those are extremely rare. The next thing that we are going to talk about are the dorsal and ventral body cavities. All right, so let's take a look at the dorsal and ventral body cavities. When we talk about a body cavity is a fully enclosed space within the body. We will talk about some other body cavities that have openings towards the outside. These are body cavities that do not have openings towards the outside. Okay. The dorsal and ventral here refers to the dorsal is the dorsum or back. The ventral would be the belly then, right, towards the front. So when we talk about the dorsal body cavity, this is where we'll see the nervous system. Okay. So if you could imagine removing the top of the skull, there is an opening in there. And that opening, right, that's created by these cranial bones here, these are where the brain would be housed. Right? So you can imagine the brain sits in an open space. Okay. That is part of the dorsal cavity and is specifically called the cranial cavity. It's created by the cranium or the cranial bones. The other is a cavity that's going to run down through the vertebral column. On this particular model, I can't open that up. Right? And that's where the spinal cord would run. These two cavities are connected. Your brain is connected to your spinal cord. We will look at these in chapters 11, 12, and 13. Okay? So you have the cranial cavity and the vertebral cavity that are both considered dorsal cavities. Now in the ventral cavity is more complex. The ventral cavity is going to include 2 main subdivisions. And this is where we will see most of our viscera. When we talk about viscera, these are the internal organs. Okay. So we have the thoracic cavity and the abdominal pelvic cavity. The thoracic cavity, this is the area of the thorax, the part that is bound by the rib cage. Right? So where you can feel the ribs, that is the thoracic cavity. It also is bound by the breastbone or the sternum. Underneath this and enclosing this and separating the thoracic cavity from what we'll see as the abdominal cavity is a thin, very important muscle called the diaphragm. Okay. I am going to attempt to remove this body wall from our model. So if you take a look at the thoracic cavity is where we have the lungs. The lungs are housed in their own subsections called pleural cavities. And notice that pleural is spelled EU, right? So whenever you see pleura with an EU, that's having to do with the lungs. Okay. So each of these is going to house a lung. We could remove those lungs. There is also something called the mediastinum. The mediastinum, this is where you would have the inside of this, you would have the pericardial cavity. The pericardial cavity is going to be just around the heart. The mediastinum will be above that. Okay. So the heart is also in here, as well as this is called the thymus gland. This is the heart. Okay. And so you can remove those. And when you remove the organs, you see that you have a cavity or a space here. Okay. We then have the diaphragm, which is a muscle that separates and creates the boundary between the thoracic and the abdominal pelvic cavity. The abdominal pelvic cavity then is where we have most of our organs of digestion. When you take a look at this, some of these organs, and we'll see these in the rat dissection, would be things like the liver with the associated gallbladder, the stomach, the small and large intestines, which come out. As we remove all of these organs of digestion, you can see that we have a cavity here. The other cavity then, there's no clear separation between the abdominal cavity and the pelvic cavity, so these are usually referred to as a single cavity or the abdominal pelvic cavity. The pelvic cavity then is where you would have your organs of reproduction, right? So in females, the uterus, the ovaries. In males, you'd have the prostate in those regions. You'd also have the bladder. Okay? And so this would be the pelvic cavity. And you will have an opportunity to take a closer look at this model. In terms of these body cavities, when I put these organs back in, I just put the organs sitting on top of one another. Okay, that's not the case in the real body. In the real body, each of our organs has surrounding it a membrane, and that membrane helps to protect it, prevent friction. Okay, we call those serous membranes, and those serous membranes have two sides to them. They have the side that wraps around the organ, and then they have the side that wraps around the actual cavity. Okay, so there's a side that lines the cavity and a side that wraps around the organ. So the parietal serosa lines the body cavity, and the visceral serosa covers the organ. Right. So whenever you see viscera, think of the organ. So that's going to help you to remember which side does what. Now this diagram that's shown here is trying to show you one way that you can think about these is that the serosae are a continuous layer. One part wraps tightly around the organ. Right? So if we're talking about the pericardium, which is the heart, there's one layer that's wrapped tightly around it and another layer that's outside of it, but it's the same tissue. So you could imagine if you had a balloon and you put your fist into the balloon, there'd be the layer of the balloon around your hand, a space filled with air, and then the outside of the balloon. That's basically what the serosae look like. We will talk about the serosae more in depth in chapter 4 when we look at the tissues. So that was the heart serosae. The other thing that you want to think about are the abdominal pelvic regions. Right? We can look at this body now and see where the organs are, but you can imagine when you have a patient that's going to come into your ER and you're a nurse, they're not going to come in and have their external area removed, right? They're going to have skin and muscle over it. So in order to try and figure out, of all of these very complex, mixed up organs, where, if someone comes in with pain, where is that referring to? Okay, so you need to go through, there are two different ways to do this. There's the tic-tac-toe board method, right, where you have a 3x3 grid. The 3x3 grid is centered over the umbilicus or the navel region, and that's called the umbilical region. Okay. Then if you think of that as your center square, above that you have the epigastric region, and the reason for that is, you might not believe this, but the stomach is this high up. The stomach is just below the sternum. If you have a stomach ache, you have pain here, right? If you go down to the hypogastric or the pubic region, that's just above the pubic area. That's where you're going to have intestines. So we have umbilical, epigastric, hypogastric. Then off to the sides in that middle region, we have the right and left lumbar region. And if you follow the curve of the back around, that's right where you'll be. Right? So if you can imagine putting your hands on the curve of the back, that's where you'll be. And then below, here you have the pubic region or the hypogastric region. And then on both sides, you have the right and left iliac or inguinal region. Remember we said that where the thigh meets the trunk is the inguinal region. Okay? Now the right and left, when you're doing stuff like this, it's always, if you're imagining looking at a patient, it's the patient's right and left, not your right and left. okay, which is something that as a medical practitioner you're just going to have to get used to doing. Now, lots of ERs and lots of other places use quadrants instead, where you divide the body into right upper quadrant, right lower quadrant, left upper, and left lower. What this does is if somebody comes in reporting pain in their right upper quadrant, okay, so this would be the right upper quadrant, you are going to think, oh, what organ do you think is maybe involved if we're talking about right upper quadrant pain? Take a look at that. Anybody want to take a guess? Probably gallbladder, right? Could be liver, right? But gallbladder is a notorious organ to cause right upper quadrant pain. What about right lower quadrant pain? Appendix, right? Then there's some things, right? If you've ever gotten that, my husband always like, oh, I have a stomach ache, and he puts his hands down low on the entirety of his belly, and I'm like, oh, that's your intestines, right? The intestines are pretty much everywhere. Right? So those are things you're going to have to think about, right? Now, there are other body cavities that open to the external environment. So we have the oral and digestive cavity, right? So the oral cavity is the cavity of the mouth. Food passes through, and interestingly enough, we are basically a hollow tube that passes through. So when you eat a cheeseburger, that cheeseburger is technically not inside of you. It's in a tube passing through you. So that entire cavity has an opening on both sides. Right? Then we have the nasal cavity. The nasal cavity has only one opening, right? So air comes in, air goes out. Air comes in, air goes out. The nasal cavity does link up with the oral cavity, but it's separate in terms of it doesn't link to the digestive cavity, or it shouldn't. Then we have the oral cavity, and I can't show you very well on this, but the oral cavity is the cavity created by the bones where the eye is housed. We also have the middle ear. The middle ear cavity is a cavity that we'll see. We will not cover hearing in A&P 1. You'll look at that in A&P 2. But the middle ear has three tiny bones, the incus, the malleus, and the stapes. And those three bones are what allow hearing to be transmitted. And they're in a little cavity. Not talking about the ear canal here, right? The ear canal that you can put a Q-tip in, but you shouldn't. That is the outer ear. The middle ear is on the other side of your eardrum, but not into your inner ear yet. There's a space there. Then in all of your joints, which we'll spend a lot of time talking about in Chapter 8, we have joint cavities, and those are called synovial cavities. Right? Those are not open to the external environment. Those are closed, and they have a very special function, which is basically to allow for movement.